Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Tracy, according to the CDC, the Centers for Disease Control and Prevention, there will be an estimated 20 million new sexually transmitted infections in the United States this year. Rates of chlamydia, gonorrhea, and syphilis, three of the most common STIs. You know, it's interesting. They call them STIs now. We used to call them STDs, but I think they're the same thing.
Yes.
They have increased in the past 2 years.
Well, all of these diseases are treatable with antibiotics. Most cases continue to go undiagnosed, which can cause infertility and other problems. Here to discuss is Mayo Clinic infectious disease specialist, Dr. Pritish Tosh. Welcome back to the program, Dr. Tosh.
Hey, thank you for having me.
Dr. Tosh, good to have you here. And the first question is, with all of the sex education that presumably our children are getting, even as early as elementary school and middle school, about sexually transmitted diseases and how to prevent them, why is it that there's been such a significant increase in STIs in the past couple of years?
And there's a lot of things that people are looking at as possibly causing this. And we saw a large decrease for a long time. And then suddenly we're seeing more and more, especially the ones you talked about. So gonorrhea, chlamydia, syphilis, which are reportable. And there's a lot of conjecture as far as why is this happening. And we don't have a great single answer, but there's a few things that people are postulating. One is actually related to sort of new technologies that are making...
There's an app for that?
There are many apps for that. In that it is a lot easier now for people who are interested in engaging in high-risk sexual activities with multiple partners to find other people interested in engaging in high-risk sexual activities with multiple partners in real time.
I was afraid you were going to say that.
Well, he said that our kids, the youth, that's not the only population where this is increasing, is it?
No, it is not. And so we're seeing it in many different populations. And one where in particular is men who have sex with men, seeing increases in these sexually transmitted infections. And some of that is related to just higher incidence in that population, but also barriers to seeking care, perceived stigma.
Wow.
And so there's things related to sort of social factors that may make it harder for people to get care or want to present to a provider to get treatment. And of course, you're talking about a sexually transmitted infection, which people will try to sort of mentally deny at first anyway. And then those are the barriers to getting treated.
So you mentioned that these diseases are reportable. So what that means that if I'm a primary care physician and I diagnose a case of syphilis or gonorrhea or chlamydia, I have to report it to the state. So the figures that you have are pretty accurate.
They're pretty accurate, and often it's done automatically. If you have a test that flags positive, it's a laboratory test that would then, for example, here, our laboratory would just automatically let the state health department know.
We got another case.
We got another case.
Yeah.
So this is, the measurements are probably pretty good.
What about drug resistance? It's one thing that more and more people are contracting sexually transmitted infections, but how big a problem is drug resistance? In other words, the antibiotics that we have don't cure the infection.
It's gotten really bad for gonorrhea in the United States and mostly also elsewhere in the world, where some first-line agents we would use, ciprofloxacin, these sorts of things, these bugs are now resistant. And
that's like Ancef or Keflex? Is that
Cipro?
Okay.
But it's to the point where some cephalosporins, like you say Ancef, some of these gonorrhea have gotten resistant to sort of low levels of that. And so now there's only one recommended agent that's a shot of ceftriaxone, whereas
for gonorrhea,
you
got to have a shot.
Got to have a shot. That's the only first-line agent.
It's resistant to anything you take by mouth.
Pretty much, in that there's resistance to low-level cephalosporin resistance. And so, so now it's gotten to the point where really you need a shot of ceftriaxone.
What do you say? What is it again?
Ceftriaxone. That's
ceftriaxone.
An antibiotic.
One time.
Yeah, usually.
Yeah.
That might be. Is there thinking that could be something that would cure people, or at least maybe help to slow the spread if people found out, oh man, if I get gonorrhea, I have to get a shot?
Hasn't worked so far.
Okay, all right.
All right, myth or matter of fact, you can get a sexually transmitted infection from a toilet seat.
So no, by definition, sexually transmitted would mean that it was transmitted during sex. Unless,
that has never stopped our moms from threatening us.
Right,
with that.
right. You could potentially get a human papillomavirus or a wart virus from a toilet seat, but by and large, you're not going to get something from a toilet seat.
I think the last time that you were here, or maybe the time before, you said that the senior citizen population is exploding quite a bit. Is that still the case?
Yeah. So
the nursing home is not what it used to be, huh?
That is true. And part of it is that when they were, if you will, younger and more sexually active, HIV wasn't
not a big deal.
Was not a thing. People didn't know about it. And so this idea of safe sex practices sort of skipped that generation. Whereas, and then, maybe they get divorced or their spouse dies and they start getting into a new relationship and they sort of revert back to their old ways. And so you have spread of sexually transmitted infections because in older people, in part because they may not be used to safe sex practices.
All right, we're sort of running out of time, but I have a couple of quick questions that our listeners I know want to know. First of all, how do you know, how can you suspect if you have a sexually transmitted disease, and then prevention?
Okay. If there are changes, if it hurts to urinate, if there's general genital discomfort, either during sex or just normal activities, then you should probably get that checked out. Things to do to prevent: barrier protection with sexual activity, condoms, trying to say not engage with multiple sex partners. The big things is safe sex practices.
Back when HIV was everyone's fear, though, in the 80s and 90s, were people a little more cautious back then, and now they're not as much as they were?
I mean, that is a thought. I don't know how well that's been proven. It used to be that you turn on the TV and it was just AIDS, AIDS, AIDS. And thankfully, we've made a lot of great strides with HIV treatment. And I don't know if that has changed the perception of risk. And that sounds like a very reasonable theory, one that I believe, but tough to prove.
All right, an update on sexually transmitted infections with an infectious disease expert, Dr. Pritish Tosh. Thanks for being here.
Thanks
Good to have you.
Thanks a lot, guys.